So I will be performing a lung and thoracic assessment on my subject, and we will be doing a posterior assessment on the patient. So I will begin with asking you some questions. Okay?
Okay.
So do you have any pain when you breathe?
No.
Okay, and do you become short of breath at all?
Yes.
And will you explain why?
I'm having a baby.
Okay, so she has a little bit of fullness in the lung area. So how is your shortness of breath? Is it all the time, or is it just when you exert yourself?
When I exert myself.
Okay, so can you climb a flight of stairs without becoming short of breath? No.
Nope.
Okay. How many months pregnant are you?
Almost 8.
Okay. All right. So do you wheeze at all?
No.
All right. And what about cough? Do you have any cough?
Yes.
What kind of cough are you having right now?
Up here.
Well, what is it? Are you bringing up any mucus?
No.
Do you cough all the time when you're sleeping, when you're awake?
When I wake up in the morning.
First in the morning. So it's like mucus plugs that you're coughing out?
There's no mucus.
Okay. All right. Do you have any hoarse voice at all?
No.
Okay. So you say there's no mucus or sputum that you expectorate when you cough. Okay. So basically it's in the morning when you wake up, and would you say it's from the dry, hot air in the house?
Yes.
That you need to clear your lungs out. Okay.
Yes, I would.
Okay. Okay. Do you have any night sweats?
No.
Do you have a history of pneumonia? Have you ever had pneumonia?
No.
Have you ever coughed up blood before?
No.
Okay. Do you have any allergies?
Yes.
What are you allergic to?
I have seasonal allergies.
Okay. What else?
Cold-induced urticaria.
Okay. Explain that.
I'm allergic to the cold.
And what happens to you when you're exposed to cold?
I get hives, or in some cases I pass out.
Okay. And do you take any medications at this time?
I take albuterol inhaler
And
twice as needed.
you also take
Prenatal vitamins. And ondansetron.
Okay, that's for.
Nausea.
Okay. Have you ever smoked cigarettes?
Yes.
And how long did you smoke cigarettes for?
Heavily for about 3 years.
Heavily, huh?
Well, 5 altogether. The first 2 were very sparingly, and then 3 as a regular smoker.
Okay. And you've since not smoking anymore, huh?
No, I quit.
Uh-huh. Do you plan to start smoking when you have that baby?
No.
Okay, better not. Okay, have you ever had a TB test?
Yes.
And has it ever come up positive?
No.
And have you ever had a chest x-ray?
No.
Okay. And when you sleep now, now it might be, but before you were pregnant, do you sleep on pillows to incline yourself so it's easier to breathe?
No.
Do you do now or ever?
Yeah.
You do now. Okay. Okay. So, first thing I'm going to do is I'm going to just take a look at your breathing patterns, okay? And you can, if we can unfold your.
I'm cold.
There you are. If you want to just take a deep breath in and out. And, okay, very good. And your color is good. And all of your anatomical markings are pretty even. So your clavicle bone here, and then you have your suprasternal notch. Her trachea is midline. And then she has her intercostal angle here, which is hard to feel. So no vascular markings, no abnormal markings on the abdomen or the chest. turn her around. Let's go. Okay. Now I'm just gonna do yep, some touching here. And do you feel any pain when I do this?
No.
Okay. Any pain?
No.
Okay, a little ticklish. All right, down your spine. Any pain?
No.
Okay. And now I'm going to do something is called tactile fremitus, and basically what I'm checking for if there's any consolidation, fluids, blood, any kind of collection of fluids in the lungs. So what I'm going to do is I'm going to put my hands on you, my palms, and I'm going to ask you to say the word 99.
99.
Okay, and then I want you to say it again.
99.
And then again.
99.
Okay, so I feel a vibration, which is a good thing. And now we're going to come down the end of her ribs, right here in the notch, and I'm going to gently ask you to take a deep breath in and out. Again. And both sides are expanding equally, so that's what they're supposed to do. Next I'm going to do some bronchophony, which I'm going to listen to her with the stethoscope and ask her to repeat the number, and I should hear her, what she's saying. And Lexi, every time I touch your back with the stethoscope, I want you to say 99, okay?
Okay.
And begin.
99.
Oops, wait a minute, I have to flip my thing over. Sorry about that. Go ahead.
99.
Go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Good. So it's pretty loud on the top, but as it gets down to the bottom, it's a little bit lower. And it sounds like, but that's normal, it's what we want to hear. And then we're going to hear the whisper pectoliloquy. And basically, every time I put this on your back, my stethoscope on your back, I want you to whisper 99. Oh, actually, whisper 1, 2, 3. Sorry, 1, 2, 3. And I should not be able to hear anything. Okay? So. Good, were you saying it?
Yeah.
Okay, I didn't hear her. All right. Now, so her, okay. Now I'm going to do some, blah, blah, blah. If you could sit straight, okay, and I want you to put your hands together in front of you and then just lean over. I'm going to do some percussions on your back, okay?
Sit this way?
Yep. And you put your hands out like, right, exactly. And so basically what I'm looking for is assessing your,
It feels weird.
your lung field. And this is telling me where your lungs are set. And see, as we get lower, the sound is more resonant, where it's more thicker up here. So this tells me where your lungs are and where your muscles are and where your diaphragm, which is down here. Actually, yours is up pretty high because of the baby. So she's doing good with that. And then just a little listening to your lung sounds. And I want you to take a deep breath in and out. And could you breathe through your mouth, please, too? Good. Excellent. And again. Okay. And then finally, that's it. We're done.